name is Masego Mekwe. I'm the acting head of the Department of Social Development Northwest. Today is the official opening of JB Marks Treatment Center for substance abuse service users. The occasion will be presided over by our Minister Lindiwe Zulu.
We are proud to announce that the JB Marks Treatment Center is today registered and operational in accordance with the Prevention of Treatment for Substance Abuse Act number 70 of 2008, its regulations and norms and standards.
It will also be presided over jointly with our MEC, Mayor Boitumelo Moiloa, and also by our stakeholders, that is the Central Drug Authority.
I want you please all to see how happy I am and how excited I am that we have a new treatment center in JB Marks, that we have committed people to run it, and a province in which it can serve a wonderful purpose. So here is a happy and excited man representing the Central Drug Authority and bringing you greetings from our chairman, Mr. David Baiva.
The treatment center is meant to assist our substance abuse service users to treat them and rehabilitate them.
Alcohol, tobacco and cannabis still remain the main substance abuse in South Africa. Structural factors such as poverty, unemployment make substance abuse-related problems particularly devastating and difficult to address. Substance abuse itself, it then ends up having a ripple effect on a whole range of things in families.
So this is a treatment center for the public. It's a public treatment center run by the Department of Social Development Northwest. This is one of the kind that has been established in terms of prevention of and treatment of Substance Abuse Act.
My department realized that treatment services were only in urban areas. The previously disadvantaged communities did not have access to treatment services. There were only 7 treatment facilities in 1994, which were not evenly distributed throughout the country. And therefore, the Department of Social Development received a grant from National Treasury for the construction of treatment centers in provinces that did not have any public treatment facility. To date, 5 public treatment centers have been built.
This center was built in partnership with the Department of Social Development National. We received financial conditional grant there. We have also partnered with the Department of Health because it's in the vicinity of the Department of Health, the Veteran Hospital. We are saying there's integrated services based on the issue of abuse of substances, as is currently a challenge that is facing our country.
This is an excellent example of IGR networking, where various stakeholders of government got together, being together, and we are doing something to benefit our constituencies, our communities. With those few words, ladies and gentlemen, please feel welcome and enjoy yourselves. I thank you.
The day today is to make sure that we make our communities and the public aware that this treatment center is now operational.
Parents invest in their children. Children invest in their parents. Government invests in its people. And the return for government's investment in people is better families, better communities, better neighbors, and better friends. I want to thank those that are representing all services that government puts in place in order for us to help our communities, for our communities to help themselves to stand on their own 2 feet.